So you want to have a better posture, do your workout, not get injured, and actually when you're working out or if you're involving yourself in any kind of activity, you want to perform better. This is the secret, so stay tuned. Hey, I'm Dr. Shaki from Irvine Spinal Wellness Center, your Irvine Posture, Movement, and Chiropractic Clinic. This is a foundational piece that I wish everyone would really give major attention to and keep in mind in every activity, from sports and higher level of performance to just normal daily routines. In this picture, of course, I never claim to be an artist. You can see that this person, I drew the rectangle as such. I took away the neck because it's easy for this to happen because you're looking at rectangle here. I want you to think of the rectangle as you're including your neck. And then you've got your extremities, your upper extremity and your lower extremity. In general, the rectangle is the stabilizer, while these are the dynamic phasic areas, meaning they are to move as the rectangle stabilizes you. That's the key. So how do we stabilize this? That does not mean you walk like a robot. What it means is you create that barrel I have referred to in previous videos. We make sure we put it here, where we have a good bottom of this barrel called your pelvic diaphragm. The top is abdominal diaphragm, and you're actually creating, all these are the muscles all around you, that you're engaging those muscles as if from the inside you're making this barrel nice and big. So that means the whole concept of six-pack and hourglass curve is out the window. Yes, that's what it means. So that means wider waist, not because you're drinking so much beer, but because you're breathing better. Your breathing apparatus is much stronger. So now that the stabilizers are stabilizing you, because your barrel is there to minimize, not prevent, but to minimize the chances of injury. Because if I've got something like a cylinder here with muscles at the side and the inside being nice and strong air, or pressure I should say, when that happens, now it's not as easy to collapse or stick out or rotate or whatever the case may be. Now, when the brain sees this stabilization exists, it can concentrate on the legs to perform better, so you can be a better runner or a better cyclist, and for your arms to be better at throwing the ball, maybe volleyball, basketball, playing golf, whatever the case may be. If your stabilizers are stabilizing your extremities that are designed to act fast, precise, and not really last, they get tired easier to perform their job, much better. This is foundational that I use in my practice and for my patients to better understand where they're at and what the goal is. So going forward, make sure you are clear on that. If you have any questions, comments, or any suggestions for future videos, make sure you communicate them to me using the method of contact in the description box, or just make a notation at the bottom of this video, and subscribe to the channel. And if you have any questions or any issues, contact the office, make an appointment, and let's see what we can do. Until next time, take care.